What is depression? It is defined as a mood disorder that causes a persistent feeling of sadness and loss of interest. It affects how you feel, think, behave, and it can lead to a variety of emotional and physical problems. The symptom must last for more than 2 weeks to be considered as depression.
How can we compare these different cultures when it comes to depression? In Denmark, it is becoming more common for people to talk about depression and is less and less considered as taboo. Although depression is heavily stigmatized in the States, the discussion of mental health and well-being is slowly becoming more normal and widespread. In the UK, the discussion around mental health is still not as prominent as it should be. In the UK and US, there are posters and signs on universities and college campuses to indicate the importance of mental health and well-being.
What's the prevalence for each country?
In Scotland, 11% of adults have reported to have 2 or more symptoms of depression. Women in Scotland are more likely to get treatment for their anxiety or depression than male patients. Prevalence in the US includes an overall rate of 7.1%. 5.3% of men and 8.7% of women are diagnosed with depression. So there is an estimation of 17.3 million adults that have had at least one depressive episode. The lifetime prevalence in Denmark is about 17 to 18%. Twice as many women than men are diagnosed with depression. Cultural differences in diagnosis. For all 3 countries, Denmark, the UK, and the US, depression and anxiety are often diagnosed together. That is, they are comorbid. It is common to have depression that is consistently triggered by an anxiety disorder, which can explain the correlation in the diagnoses. Treatments. Are there any differences between the 3 countries?
UK psychologists recommend patients who have mild depression to exercise consistently. For those with moderate depression, UK psychologists recommend using cognitive behavioral therapy or counseling. But for those who have severe depression, antidepressants, combination therapy, and interpersonal therapy are all highly recommended. Treatment in the US is very similar to the UK. The US psychologists highly recommend using antidepressants and psychotherapy methods. U.S. psychologists also recommend hospital and residential treatment. With more severe cases, it's highly recommended that electroconversion therapy and transcranial magnetic stimulation are used as treatment methods. Treatment in Denmark is very similar to both the UK and the US, but Danish psychologists highly recommend either using short-term psychodynamic therapy, cognitive behavioral therapy, or interpersonal therapy. Studies have shown no significant difference in effect of each individual treatment.